I am Dr. Sisir Kumar Patra, Hematologist, Haemato-oncologist and bone marrow transplant physician of Narayana Superspeciality Hospital and RN Tiger Hospital, Kolkata. So today our discussion about the ITP. ITP actually, this is full name is Idiopathic Thrombocytopenic Purpura. Idiopathic Thrombocytopenic Purpura can happen in any age group, like it can happen in childhood, it can happen in middle age group, also it can happen in older people. So it is idiopathic thrombocytopenic purpura. The cause actually for the idiopathic thrombocytopenic purpura is unknown. What happens in this disease? In this disease, patient's bone marrow produce adequate or more than adequate number of platelets, but when these platelets come out to the peripheral blood, these platelets are destroyed. So in peripheral blood, we got very less amount of platelet numbers. Okay. So if one patient diagnosed as ITP, for this patient who are initially diagnosed as a ITP and after initial treatment, if they cure, that is fine. That is known as acute ITP, and after treatment, if it is cured for the life, that is good. Some patients may need one or two more different kind of treatment. After that, they can be fine for life. But few patients of ITP is a chronic ITP, chronic disease. They don't even respond to the 1, 2, 3, 4 line of management. For this patient, life is bit of troublesome. Okay, so I am sharing some patient experience. One is a young lady, 24 years old lady. So one day at evening, I am leaving from my hospital. That time she came to the hospital with a swelling in the left arm, and I go and see the patient. In her arm is completely cold, clammy, and there is no peripheral pulsation. So this is a kind of emergency. When I did urgent doctor of the left arm, we see that there is a huge bleeding in the left upper arm, and then for that there is a pressure effect in left arm, and there is a cold, clammy arms, and there is a feeble pulse. So immediately taken measures. Our team, like vascular surgeon, all team has come. Whatever necessity requirement we did, and we did at night bone marrow study. Immediately our pathology is so strong. Immediately they have give us the diagnosis, and immediately we started treatment. And for that treatment, she gradually improved, and her platelet count when we start the treatment, her platelet count was only 5,000. After that, gradually her platelet increases, and she discharged. But after 2-3 months, she's absolutely fine. After 2 to 3 months, again she has the same problem. Again her platelet count come down, but this time she is aware. So there is some purpuric spot in the skin. So immediately she came back. Again we have given second line of treatment, and again she is fine. And after 3-4 months, again she has developed same kind of phenomena, low platelet again. So you have to understand this. This is a kind of chronic ITP. Whatever treatment we are giving, she is respond initially, then again her disease come back. So for this kind of patient, it is very difficult to lead normal life. Okay, and this patient is always they are thinking that my platelet is going down. They are not able to comfort to ride bike. Okay, so they are fearing to ride bike because if there is any accident, there will be intracranial hemorrhage, chances of intracranial hemorrhage. They are always thinking that my platelet will go down, and for that, their family also have some kind of stress. Always there is some stress. Their families also. So it is very difficult to live with the ITP patient. ITP is a benign disease, but those patients who are not responded adequately, or those who are going to chronic ITP, it is very difficult for them to live life. Okay. Same thing, I am now going to discuss about another patient. It's a very small kid, 10 years old child, came with low platelet count and bleeding from the nose. And we did bone marrow, given IVIG treatment, first line of treatment, with support of injection steroid, and after that his platelet count is become normal, and after that 6 months, 12 months, and 2 years. After 2 years even his platelet is completely normal, but still his parents are always think that it will come back again. So another thing is that Another patient I want to discuss. This is a around 50 years old lady, and she presented with huge menstrual bleeding in each cycle. So she went to the one gynecologist. Naturally, she will go to gynecologist. She has completely checkup done, everything done, and they did hysterectomy. After hysterectomy, her bleeding has not stopped. Before that, I don't know what is the platelet count, all these things, I don't know. Then she referred to us for the further evaluation and management of the bleeding. So we check here, and platelet count come only 20,000. So we did bone marrow, diagnosed at ITP, and we have treated her with IVIG and other medications, and she is absolutely fine for that. And she is completely responded with the first line of management, and she is fine for life. That is the thing, that some patient is going very smoothly and some patient need chronic treatment. We have another patient I want to just discuss. This is a 15 years old girl, and she came with again purpura spot in the skin. So we have treated with the IVIG first. She responded well, go home. And after that, 15 days, she came back with again nasal bleeding. We have checked, platelet is very low. We have given second line of treatment, steroid with rituximab, past steroid with rituximab. She initially responded, but her platelet is never gone up more than 10,000. So it is very difficult for the family and she used to give her 10th class exam. She is not able to concentrate in study, and she used to have steroids. For this steroid, she has some acne in the face. She has a facial swelling. That is also one cosmetic part. And family is completely disturbed for that. And after that, we decided to go for the splenectomy. Even after splenectomy, her platelet count is never gone up more than 30,000. Counsel this patient for the life. So ITP, again, it's a benign disease, but the chronic ITP, to treat the chronic ITP patient and for the family member, it is very difficult to handle this patient. Okay, thank you. I talk about patient who are responding well, that is fine. Who are not responding well, that is the problem. But I can say today, who are not responding to first line, second line or third line, even after that, there is there is nothing. So there is a very good hope. You have to go for the hematologist, good hematologist. You have to have faith with one doctor, and there is a very good medicine are coming. Now a TPO receptor agonist like Golate, like Romiprostim, these all medicines has come. All newer medicines, there is several newer medicine also coming. And if you have faith on your doctor, if you have faith on yourself, you can have a very good life in future. So don't think about the platelet count. I request all chronic ITP patients, don't think about the platelet count. Only if you have a bleeding, then only it is trouble. Otherwise, if your platelet even 20,000, 30,000, don't think about that. Your platelet is low, you should have bleeding. Don't think about the count. Only think that if there is a bleeding, then immediately come to the doctor. And there is a hope that more medicines will come, and our problem will be more easy to treat all this chronic ITP patient. Thank you.